Today, we're going to talk about the stuff that actually drives production inside of a practice. So, kind of like what your team says, how your systems run, and really why patients say yes or they disappear on you. We've all had that happen, I know. So, my guest today got a business admin background. He's spent over a decade managing dental practices. And since 2001, he's coached more than 250 offices across the country. He's a true expert in case acceptance, verbal skills, personality profiling, and he's obsessed with stopping cancellations, handling objections, and asking patients for referrals and reviews. And he also knows how to structure financial arrangements and third-party financing so you're not chained to insurance, which everybody wants to know more about. Hey everyone, welcome back to the No BS Dental Growth Podcast. I'm your host, Chris Pistorius, and today we're going to talk about the stuff that actually drives production inside of a practice. So kind of like what your team says, how your systems run, and really why patients say yes or they disappear on you. We've all had that happen, I know. So my guest today is Eric Vickery. He's got a business admin background. He's spent over a decade managing dental practices. And since 2001, he's coached more than 250 offices across the country. He's a true expert in case acceptance, verbal skills, personality profiling, and he's obsessed with stopping cancellations, handling objections, and asking patients for referrals and reviews, which I'm always harping about, by the way. And he also knows how to structure financial arrangements and third-party financing so you're not chained to insurance, which everybody wants to know more about. So this one's going to be super tactical and very actionable. So let's jump in with Eric. Eric, how are you?
I'm great, Chris. Thanks for having me. I love your podcast. And so I'm very
Awesome.
excited to be on.
Yeah, well, I know this is a hot topic for a lot of our folks out there. When we talk about case acceptance, what do you think is the number one reason why? I'm just going to jump right to it. No BS, right? So, what do you
Mhm.
think is the number one reason people say no to treatment?
I don't think they understand what's going on. I don't think they understand what's going to happen if they don't get it taken care of. I'll tell you just a quick story. My mom called me up and she just said, "Hey, I want to let you know that tooth's not bothering me anymore, so I canceled my crown appointment."
Yeah,
So, I spent about, I don't know, 4.5 minutes on the phone with her, and she goes, "Okay, I'll call them back and reschedule it."
yeah,
And I said, and give them my card. People, what the number, two things. Dental offices don't want to be salespeople.
yeah.
They don't want to be known as pressure, which I totally agree with. They don't want to be known as pressure salespeople. Okay, fine. Then number two, why is the most common phrase heard in dental office, "You need a crown"? Because that's pressure sales, and people only hear crown, and they think money, and in their mind as a non-dental human being, they go, "Well, a crown is that's when I have pain."
Yeah,
They'll call the office. I'm sure you listen to the new patient calls. Yeah, how much is a crown? And they haven't been a dentist in 4 years.
right.
They're having sensitivity, they're having a problem, they don't understand. They don't call up and say, "I'd like to schedule a D0150 comprehensive examination, please. I'm having pain in number 3. I've been to the dentist for it." They don't know what to say. They say that, and we perceive it to be, "Oh, this is a shopper," or "They're just price shopping for crowns," and people are so money conscious. No, they don't understand what they don't understand. We have to do a better job at helping people process this. So we work from a sales perspective where we do no pressure sales at All Star, and our case acceptance mastery starts with foundation principle number 1 in sales is this: people don't buy a solution to a problem they don't perceive to have.
I think
Helping
that
people understand what's going on and what's going to happen if they don't do it. That's what we want to do. So we have rules and we have verbal skill systems that are applied to help dissolve that problem to make sure that doesn't happen.
Yeah, I think you hit a lot of very strong topics there, and it's not just case acceptance. It's even like with front desk reception, like just talking to patients, who are, how you brought up, they're really trained nowadays to say, hey, how much is something? Because like you said, they don't know what the hell to really ask for specifically. The only thing that they really know is price, and they're trying to compare everything to a monetary unit. So how what can front desk people, case
Yeah.
acceptance experts, what can they do to change that language a little
Yeah.
bit and improve these numbers?
So All Star Dental Academy was founded by Alex and Heather Nottingham on phone skills, the great call
Mm,
process, greeting, rapport, engage, ask for the appointment, take the information. So what typically happens is when a patient calls in and the admin person has not been trained, the person asking the questions is the one that's in control of the direction of the conversation. So you
Mm,
answer the phone, and I go, "How much is? Do you take?" Or something really intelligent like, "Are you taking new patients?" "No, we're
mm,
going out of business." They just don't know what to ask. And so if you are just an answering service and you're just answering questions and there's dead silence, well, okay, well, thanks, bye. There's
yeah,
you don't you have to know how to get control of the conversation a very nice way by being the one who answers the question. And a simple coaching hack is, "Oh, Chris, I'd be happy to help you out with that. Again, my name is Eric. Who are the pleasure say I didn't know your name. Oh, I'd
yeah,
be happy to help you out with that. Again, my name is Eric. Who the pleasure of speaking with. Oh, Chris, wonderful. Well, when was the last time we saw you in our practice? Oh, you've never been? Well, welcome to practice. Thank you so much for choosing us. Tell me what's going on right now. What are you experiencing? How long has it been?" Just ask questions and you build rapport with them by being interested, not interesting. Instead of the answering service and being transactional, you want to shift to being relational. So when you
yeah,
shift to being relational, you have a shot. People
yeah.
call up and
It,
say, "Do you take Medicare or something?" They think, "Oh my gosh, this phone call. No, we don't take Medicare. I'm so tired of hearing this." Well, that person just doesn't know what to ask. You have to
exactly.
engage first. What we see is this. Look, a patient who's looking for a high quality dentist wants somebody in their mind they can trust. And trust is going to only be developed in someone who has relationship, and relationship has to have this flavor of credibility. So what that means is you could be a level 10 clinician, but if you're a level 5 communicating team, the patient's perception is, well, your credibility is way down here as a 5, then you can't even get into building trust. You can't even doesn't even feel like I could build a relationship with you. And the phone call is transactional. So the phone call is a great way to really get case acceptance moving in the right direction. Like we always talk about, it's the first impression. Now we know it's the website, the referral source, and all those things, but it's an extension of that. And they're not scheduling if the phone skills aren't, just locked in and really, really good. So we love our process for training phone skills, and it definitely influences how the patient shows up with expectation.
Yeah. Do you guys, when you do phone training skills, is it a do you do online and in person, or just online, or just in person? How do you usually do that?
Yeah. Yeah. So all of the above. All Star Dental Academy is an online training platform that you can access anytime you want, 24/7.
Gotcha.
And our recommend look, repetition is the what mastery of skill or something like mother of skill. I think that's what
Yeah.
the saying is. And it's just 20 minutes a week reviewing how do I do phone skills. There's scheduling, there's stopping cancellations in there. There's even a dental MBA. I mean, there's Alex and Heather have done an incredible job of filling out all of the training opportunities. And then my coaching division, we have 13 coaches working with clients all over the country, and
Wow.
we're working like this virtually with them. And
Yeah.
then I'm leading a seminar live. We were just in Fort Lauderdale. We have an event in May in Fort Lauderdale where we're doing live training in person you come to, or you do virtual training with your coach once or twice a month with the team on how to work through things. We like our teams to listen to their recordings. I would tell any administrative person, listen to two things every month, two calls, a really, really good one that you crushed, that you did really good, and one where you just didn't get the person to schedule. What's the difference?
Yeah.
What's the difference? If you can't figure that out, put it in the hands of a coach, put that in the hands of a team member, and just figure out, what do I need to do differently here? And it's
Yeah.
funny, when we go through that great call process, the ask for the appointment, oftentimes we want to do one of two things: make the patient say no, or answer a nice open-ended question so they don't feel pressured like this. So,
Yeah.
Chris, how would you feel about going ahead and getting your first visit scheduled here in our office? Even if you know it's probably a no, I want to make them say no to me, even if you know
Right.
that. Or you could say, feels like Chris it would make sense to go ahead and get your first visit scheduled here in office. Am I right? And you have to
Yeah.
say no to me to do that. But I would love for you to give me as much language as possible so I know where you are, so I can converse with you on that. I'm having a conversation with you. It's not transactional. I can't emphasize that enough. And they should feel like when they walk in, "Oh, you're the person I talked to on the phone. You were so nice. I'm so glad I got to meet you. I'm nervous coming to the dental office. You make me feel like a little bit less nervous."
Yeah.
And
Yeah.
that's how it should be. And it should be effective, and we should be getting people scheduled at a much higher rate than what's the national average. Like, was it 22% or 33% of
Yep.
calls are converted or something? It's really,
Yep.
really, really low.
Yep, it sure is. And there's more people that are finding dentists now on Google and now AI,
Yeah.
and they're going down a list.
Chat.
And
Yep.
yeah, it's crazy. And
Yeah.
yeah, I listen to these calls all the time. And it's just a different, it's not, a referral. It's somebody that doesn't know who you are.
Yeah.
They found you
Yeah.
on a list. They have no idea what value you bring. And if these
Yeah.
front desk people, case acceptance people can't really demonstrate that value pretty quickly, they'll just go to the next one on the list,
Yeah.
and
I would imagine they're calling 5 offices, let's say 4 or 5
yeah,
offices. There's your 25% conversion rate, 1 out of 4, they're gonna schedule with one of them. Well, who are
yeah,
they scheduling with? They're scheduling with, first of all, the one that answers the phone,
yeah,
that doesn't put them on hold right away, that's or they're not at lunch or what have you. Number 2, they're scheduling with someone that makes them feel really good while they're on the phone with them.
yes, empathy, sympathy.
Yeah, so
That's
have
why AI
engagement.
will never, in my opinion anyway, will
Yeah,
never replace a human conversation in healthcare. I think
yeah,
if you're ordering pizza, who cares if it's AI? But if you're talking
yeah,
about healthcare for your family, yourself, you want that
yeah,
empathy, you want that sympathy, you want to hear that they've seen a lot of people just like you, and they can help you and get you out of pain and make your smile look better and all of this stuff. And at least right now, anyway, AI can't do that effectively. So I always tell people that about AI, and
yeah.
I think it's a great tool for instead of voicemails, perhaps, but don't start replacing front desk or certainly case acceptance people with the AI.
We have a verbal skill we use. Heather Nottingham teaches so well on our online platform called Share the Sizzle.
Ah,
And what people are looking for is, did I call the right place? Are you able to really help me with what specifically I'm looking for?
yeah,
And when you just simply go, yeah, we could do that, that's not really instilling confidence in your competence. I
right.
want to really know. So when I say, Chris, the fact that you're looking for somebody who does implants and can really do it well, our doctor's been doing that for over 10 years. You're
Yes,
talking about hundreds, if not thousands of procedures of happy patients. You know what? Check out, I can email you a link to our Google reviews where you can see what people have said. You can go to our website and look at our reviews. People are specifically talking about how we helped them with tooth replacement and did it in a way that made them actually enjoy going to the dentist. We'd love to
right.
help you just like that. How? How would you
Yep,
feel about going ahead and getting your first visit scheduled? That's what we're looking for in that verbal skill. And you're going, yeah, that's where I want to go. I want to be impressed with your language. You're telling me what it's going to be like. Well, you're telling me either by saying nothing, you're telling me it's not going to be that great, or you're telling me it's going to be awesome. You're setting the bar and you raise your verbal skill to a level 10. Now all of a sudden your verbal skills and your clinical training are at 10. It needs to all match.
yep,
So, yeah, and then once we get them in, then we go through the exam in a way that is focused on getting them to understand the conditions. You can't just show them a picture and go, that's fractured. You need a crown. That does
right.
not work anymore. You've got to explain what's happening with really, really good verbal skills, word pictures, analogies, describing what's happening and what's going to happen if they don't do things.
Yeah,
And you don't do it in a way that scares them. You don't say you should do this. That word should. We should be careful how we say that word.
yep,
And you don't want to tell anybody that. You want to use questions. You want to say, Chris, has this tooth started to hurt you yet? Have you ever had a toothache before? Do you know anybody who lost a tooth from like a vertical fracture? Have you ever heard of this before? Okay. You have to have these questions because by using questions, you're implying here's what's coming when you don't take care of this. Instead of
right.
my mom saying, yeah, it's not bothering me. Well, it's not gonna
Yeah,
that's not cutting it anymore. Yeah.
yeah.
So
I have to admit, I've
on
done
the
that before too.
yeah. Yeah, I think it's the perception. It's you're self-diagnosing going, well, it's not hurting. I have a
Yeah,
saying, I say no pain, no problem, no pay. And
yeah,
we
right,
have to help them understand that pain is not a dictator of where there's a problem. Not early stages of cancer do not hurt.
right,
So pain is not an indicator. That's not what we're looking for in dentistry. We're looking for getting the patient to see it with their own eyes, hear it with their ears in a way that is simple for them to understand so that they're asking you for a solution. Or we have a verbal skill called the case presentation formula. We follow a formula to help them understand what's, here's what's happening now, here's what's going to happen if you don't do anything. How concerned are you with that? And just
yeah,
seeing if they're in. If they believe there's a problem, then you have the right to proceed. Great. Let's talk about a plan.
right.
And then
Right.
after the plan, you say, how do you feel about this plan? So there's the how word again is so powerful in really finding out, am I about to schedule a future no-show appointment, or is somebody really in on this and I feel
Yeah.
comfortable moving forward? Because when you
Yeah.
go, Chris, do you see a good reason why you wouldn't want to go ahead and get this crown scheduled today? And you go, I don't even know if you know what you're supposed to say to that.
Yeah.
It's like a double negative.
Feel
So,
like I'm in a
and you
car
go,
dealership.
yeah, exactly. The
What's it
pressure and
gonna
all of
take
that.
to
And they
get
go,
you into
"Ugh."
this implant today?
Exactly. Yeah. Yeah. These leather seats, these leather crowns.
Yeah.
So they go, yeah, yeah, put me down for something. And as soon as you hear that, you're going, oh man, I don't know if they're
Yeah.
in. Or
Yeah.
they go, well, how much is it? They're looking for an excuse. Instead of somebody saying, I didn't realize it was so bad. What do I need to do to take care of it? Great. Here's your solution. How
Yeah.
do you feel about this solution? Have conversation with them. So it's on the phone, it's chairside with the doctor, and then the transfer back out to the front, whether it's a patient coordinator or someone who's going to go over financial options, the treatment plan and scheduling. That language is all used throughout that entire process. So the rule we use is called 95-5. 95% of your communication versus 5. 95 is focused on condition and consequences, and only 5% of your words are focused on treatment. Treatment does not have to be what you talk about. We want to talk about crowns and bridges and implants and veneers and root planings and periodontal this, and all of that sounds like money. Instead,
Yeah.
when I bring the patient out front, I say, Betty, Chris and Dr. Smith both really want to get the infection in his gums taken care of. Right, Chris?
Right.
And and now I'm not telling you what you need to do. I'm using the word want instead of need. And you can honestly say, yeah, I want to do that because of the conversation we had out back.
Right.
And now a person up front's not getting a dump off. They're not getting a, all right, Betty, Chris just needs 4 quads of scalar root planning. All right, all set. Have a good day. If you have any questions, let me know. I mean, that
Yeah.
that empowers nobody. Again, now we're back to level 5 or lower communication. And now we're wondering, why are we getting people who cancel appointments? And I could go on
Right.
and on about stopping cancellations, but lots of
Yeah.
verbal skills there too. Yeah.
Yeah, totally agree. You're dropping bombs there. I hope everybody really pays attention to that part because you gave away some golden nuggets that are so true. Now, I get asked a lot though. I get, we don't really, we do informal coaching when we
Hmm.
see marketing campaigns slide a little bit. So we start listening to calls and say, well, Trina has this hesitancy to put people on hold too long, or this, that, or every kind of look for some high level trends to help the campaign, right? But with case acceptance, I do get asked quite a bit about what's the best way to handle. I need to think about it. What do you think about that?
Okay. So when someone says I need to think about it, my first instinct is thinking, okay, where did I lose them?
Right.
That's a temperature check. When I say, Chris, how do you feel about moving forward this plan? You go, well, I need to think about it. Oh, I'm happy to help you think about this and process. No pressure from us. We never want you to feel pressured. So that make sure you have all of the information and everything you want to think about. So you make a great, healthy decision. What sort of information can I provide you on your decision? Is it cost? Is it, do I really need this? Is it value? Help me understand. And so I'm eliminating, well, what's the objection? Is it a money? Is it
Yes.
lack of urgency? What is it? And then you go, yeah, I'm just not sure I need it. Boom. Now I can go back into realizing I didn't have impact when I did the
Right.
95-5 rule and I test the buy-in and I ask you, how concerned are you with this? So
Right.
now, if I did all that really well, and then I present it and you go, I really need to think about this, it's probably going to be money. It's probably how do you,
Yep.
so then you probably say, well, it's just the money part. I go, listen, I totally get it. Figuring out how to make it affordable and fit in your budget. That's why we have magicians who do this. They know how to figure out how do I make this as easy to move forward with as possible, to make the payments as easy as possible. Is that something that you're looking for? And if it's not, you'll tell me it's something you're like, I would just never spend $5,000 on my teeth or whatever.
Yeah.
Okay. Well, we've got payments out that will make this really easy for you. And I'll put an asterisk on this. We don't recommend 12 months and beyond financial arrangements unless we're talking about the whole mouth.
Right.
Very rarely are we saying, let's do single tooth dentistry for 12 months, no interest. Because
Yeah.
when are they doing tooth number 2 in 13
Yeah.
months? That's not
Exactly.
helping anyone. That's not
That's a
helping
great
anyone. So
point. Yes.
yeah, our goal is how do we get this patient as healthy as possible, as quick as possible by removing the friction points. And what are the
Right.
friction points? I don't know, I don't understand, and I can't afford it. I don't
Yep.
see value or urgency because it's not bothering me, or I can't afford it. Well, we can make it affordable for people. We can
Yep.
absolutely do that. Think about an orthodontist. They've been doing this forever. They've been doing this forever in ortho. Why are we having a problem in general dentistry? We don't have to
Right.
have this problem. We have people who aren't willing to get out a financial arrangement worksheet because they don't want to pay the 7.5 points on the cost of the treatment because they're locked in on a horrible insurance PPO plan and their fees already stink. Well, as you read in my bio, let's talk about that. Let's go insurance free, and that's a loaded comment.
Yeah.
We believe in out of network participation where the check still comes to you. And we help offices all the time get to the place where, like, oh my gosh, I actually have the financial freedom to offer things to my patients to make it so that they can make payments. And I don't feel like I'm paying people to come see me.
Right.
So I think the average PPO rate's 42% write-off rate, and we're worried about a 7% cost of
Yeah.
a business cost of making things affordable.
Yeah.
So we've got
Yeah.
it backwards sometimes. We got to fix that.
Yeah. So to kind of summarize that one, I think for people is, when they say they have to think about it, there's something going on. There's an objection there. We just have to
Yep.
uncover it. Would that be
Yeah,
fair?
you dig deeper. Yeah, you
Yeah.
dig deeper.
Deeper.
So our
Yeah.
our formula for that is simply to engage. We acknowledge and we engage. We say, I hear it, I hear you, I get it. I acknowledge, I engage, and then I ask questions. So I
Yeah.
acknowledge it.
Yeah.
I say, I hear what you're saying. I would feel, I'd want to talk to my wife and think about it too. Let me ask you this. Is it this or is it that? And then I
Yeah.
usually will give them two potential objections that I think it might be. I don't think money is as big of an objection as people think. I think it's a smokescreen. I think it's lack of urgency is the number one objection. And that is because we're not doing things like the 95/5 rule. We find that when our clients use our system from great phone call all the way through case presentation formula, the objections go away.
Yeah.
I will, other than life conditions. I want to, but I can't. That's different. Yeah.
Yeah. Yeah. Well, we're going to wrap it up here in a minute, but I know that there's 100 other questions people are going to want answered and probably will yell and scream at me. But I'd love to be able to maybe in a few months do another episode of this
Let's do it.
and continue
Yeah.
our conversation. But
Yeah.
and we covered a little bit of this, but I do hear a lot of it. You mentioned it just now, the financial reasons. But um, what do you think is the best way for in case of acceptance? Teams to present financial options without killing that momentum of the doctor saying you
Yeah.
really need to do this, and maybe they did a great job of, if you don't
Mhm.
handle this, this is what could happen. You've
Yep.
got that momentum going, the patient is agreeing with everything, but then you got to talk money. So what's
Yeah.
the best way to present those options?
The first thing I find is people have it they have to have the right mindset. If you're going to be a financial coordinator, you have to have the right mindset. You first of all, you can't have this approval addiction, you can't have fear of rejection. The second thing is you also can't be a bully. You can't be
Mm,
this, really really direct person and tell them what they need to do again. So you got to find that middle ground where I say, Chris, I'm so glad that you and Dr. Smith have made a decision to take care of things. I love the plan that you guys are talking about. I think things are going to look amazing. My job is now, how do I make this as easy for you as possible on the financial side? And so what I'd like to do is go over all the options we have to make this affordable for you. And you can choose whichever option you think works best for you. And then I literally have 3 to 4 options on prepay savings, extended payments, and may have half down, half as you go type, in office sort of situation.
yeah.
And one of those options is going to work for a vast majority of your patients. It's
Yeah.
the person who's, I'm on a fixed budget. I haven't met anybody who's not on a fixed budget, but I'm on a fixed budget is what they say. I can only afford so much per month. Well, let's figure out a payment plan where I do. Why would you pay tooth by tooth by tooth for the next 5 years and end up with
Yeah.
root canals and lost teeth? Instead, why don't we do it all right now, the next 5 months, and you can still pay for it for 5 years? The
Yeah.
the small amount of interest you're going to pay on the loan is a lot cheaper than root canals and extractions and
Yeah.
implants.
Yeah.
So let's do it right now and let's do that. And you just have to have the right knowledge. You have the right perspective of that as a financial coordinator to go, this is how everybody buys everything that's worth it.
Yeah. Yeah.
People who
That's a
want
great point.
things that are valuable, we make payments on them. Very, very, very few people go pay cash for their 50 to $100,000 car now. That's pretty
Yeah.
rare.
Yeah. Yeah.
Yeah.
That's very true. Sorry, I lied. One last question I think is necessary here, but um, what would you say to I guess what's the best way to frame this? What's kind of the best way to go about these calls we talked about a little bit earlier when they're Medicaid or they're an insurance you don't accept? Um,
Mhm.
what's the best way to at least probe into that and see if you can get them as a patient? And have you
Yeah.
seen these be successful in
Yeah.
the past?
Yeah. I'll tell you a story. So we taught this, had a team use the verbal skills of asking questions, digging deeper, building relationship. And I'm not talking about a 30-minute new patient phone call. Nobody has time for that.
Yeah.
Just as long as it needs to take. And this elderly lady, she's probably in her 70s, right in our wheelhouse for what we want to do for whether it's all on four or full mouth dentistry. And she called up and said, "Do you take Medicare?" Now, before our training, the team member would have just said, "No, I'm sorry. We don't work with them. Phone call over."
Yes.
Very, very unfortunate. Happens a lot. But with our training, she was able to thank her for calling, get her name, talk about, when was the last time we're in our office? Oh, new patient, welcome to practice. And who may we thank for referring you? And at that moment, when they got to that place of asking questions and the greeting, she said, "Oh, my three best friends that I live with at the retirement community all come see you."
Mm,
Well, she knew all three of them pay cash when they come in. So again, this is the perfect example of somebody who just didn't know what to say when she called in.
yeah.
Just knew what she knew. Okay.
Right.
So they were able to engage into a conversation, go, "Oh, we'll take care of you the same way we take care of all of our patients who have Medicare. We
Ah,
have a membership plan. They pay $48 a month for all their preventive services, and it creates savings for you when you see the doctor. It's amazing. How does that sound to you? And then
yeah.
ask some questions, explain, ask questions. So
Yeah.
the system works. Now, if somebody goes, I can only go to an in-network dentist, I refuse. Well, okay. Well, we we fix $5 haircuts. I'm not picking anybody who's in network. We have a lot of clients who are network. I'm teasing. But like, a Medicaid practice for an adult, nobody's explained to them how that works. So I tell, this is my verbal skill for that, Chris. I go, "Chris, it sounds to me like you've been calling around asking people this question. Am I right?" And they go, "Yeah, you're like the 12th person I've called." Okay. Has anyone taken the time to explain to you why it's called Medicaid and not Denicaid? No. Okay. Think about it for a second. You're an adult and you have Medicaid. The only thing they're going to cover is like you're in an emergency room and you're having an extreme toothache and they're going to give you pills. That's it. Maybe there's a way that they pay to cover an extracted tooth, but you're trying to save your teeth, right? Okay, so here's what we do with all of our patients who have Medicaid that come see us. That's a key verbal skill.
Yeah.
We have a lot of patients who have that in that same situation come see us. We offer a membership plan. It's only $48 a month, and you have access to all of our preventive services. There's no cost in addition to that when you come in for your hygiene visits. And then when you have dentistry that you want to do with a doctor, we're upfront about how to make that affordable with payment plans and options that we have. How? How does that sound to you? And get them talking and
Yep.
just see where they're at. Now, that might not be what this patient wants to hear. And then they go call around four more places. And guess what they're going to hear? No, 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 no. And they're going to remember
Yeah.
me. Call me
Yep.
back. I'll get their
Yep.
number. I'll call them back in a week. So there's a system for all of it. It's not a silver bullet. I would be doing a lot better if I had silver bullets, but
Yeah.
there's no perfect
Me
solution, but
too.
we can improve our batting average with really good verbal
That's right.
skills.
Even if you get
Yep.
10% of those people, just imagine what that adds up to month over month, year over
Yep.
year. Right.
Yep.
So,
Yep.
anyway,
Yep.
Eric, thanks so much. This has been truly one of the best episodes that we've done in a while. This is going to really hit home for a lot of practices. If somebody wants to work with you guys, what's the best way to reach out?
We love talking to people about what their best options. We don't think we're the only coaching company. We know we're not the only coaching company. So we're happy to just listen and see what the best options are. So I would email Heather at allstardentalacademy.com. She's our co-founder. She'll
Okay.
she'll love to just meet with you and talk with you about what's going on and figure out what your best options are. You can look at allstardentalacademy.com and see all the things we offer. You could come to one of our events. I'm doing case acceptance mastery for the AGD at their home office in Chicago in March, or you can come to Fort Lauderdale with us in May, where we do our annual event and we focus on case acceptance and 2 days of growth. It's a lot of fun. So any of those will work.
Awesome. Awesome.
Yeah,
Well, have huge thanks, Eric. I appreciate
yeah.
for hanging out with us and breaking all of this stuff down, how to use verbal skills. Just it's just so powerful. I think that a lot of people really need help with this. The cancellation stuff was great, how to structure, conversations, and, just understanding the value of these positions within the practice. So now, if you got value out of this, and I know you did, please go out check out Eric's work. Like he said, check out the website. And always, if you're a dentist or a practice owner who wants more new patients, better systems, less chaos in your marketing, you can always connect with me as well at the Kickstart Dental Marketing team. We'll also have that link below for you. And if you enjoyed this episode, follow it, subscribe, drop us a rating and review, only if it's a good one though, and then share this with a colleague who's constantly complaining about cancellations and case acceptance, because this might just be the episode that fixes it. So thanks for listening. I'm Chris Pistorius, and I'll see you on the next episode of the No BS Dental Growth Podcast.
Thanks for joining us this week on the Dental Marketing Podcast. Make sure to visit our website, www.kickstartdental.com/podcast, where you can subscribe to the show in iTunes, Spotify, or via RSS, so you'll never miss a show. While you're at it, if you found value in the show, we'd appreciate a rating on iTunes. Or if you'd simply tell a friend about the show, that would help us out too. If you are ready to grow your practice, then you might want to schedule a free strategy session with us. Just go to kickstartdental.com and click the free strategy session button and give us 15 minutes of your time to change your practice forever. Be sure to tune in next week for our next episode. And thanks for listening to the Dental Marketing Podcast by Kickstart Dental Marketing, where dentists go to win online.